So, when a surgeon finishes an operation and closes an incision, you might think the main event is over. But really, a whole new chapter is just beginning, the healing process. And of course, with healing comes the risk of infection. So, how do we actually track that risk? How do we get past just a quick look to get real, hard data? Well, we're about to dive into a tool that does exactly that. It's a really important question, right? Is it enough for a doctor or nurse to just glance at a wound and go, looks a little red? Or is there a better, more consistent way to tell if a patient is actually developing a surgical site infection? The whole idea is to turn a simple observation into useful, actionable information. And this right here, this gets to the very heart of the problem. On one side, you have these subjective comments. One doctor's a bit red could be another's totally normal. That kind of inconsistency, it can lead to delays in treatment or even missed infections, which is a huge deal for the patient. What we're aiming for is what you see on the right, a standardized quantitative system where everyone is speaking the exact same language. And that's precisely what the medical community created. A common language isn't just about using the same words. It's about having a shared playbook, a framework everyone understands. In this case, it's a scoring system that brings some much-needed clarity and consistency to every single wound checkup. It's called the Asepsis Scoring Tool. And at its core, it's a pretty clever system. It takes all those clinical signs, the things a healthcare professional can actually see and measure, and boils them down into a simple number. That score then gives everyone a really clear picture of how that wound is doing. Now, the full-blown asepsis tool is actually pretty comprehensive. It looks at 7 different parameters to get the full picture of a surgical site infection. But for most of the day-to-day clinical work, the focus really narrows down to a core group of the most important indicators. Okay, so let's break down these 4 key parameters. These are really the backbone of the whole assessment. You can think of them as the main visual clues that tell the story of how a wound is healing or not healing. So, what are we actually looking for? First up, serous exudates. That's just the medical term for that clear, watery fluid you sometimes see. Next is erythema, which is the redness around the incision. Third, and this is a bigger red flag, is purulent exudates, a thicker, often colored discharge that's a classic sign of infection. And finally, separation of deep tissues, which is exactly what it sounds like. The wound itself is starting to come apart. So, knowing what to look for is step 1. But how does a clinician actually use this tool in a real-world setting? Well, there's a really clear, straightforward process to get that all-important score. It all boils down to these 4 logical steps. First, you inspect the wound carefully. Then you systematically check for each of those 4 key signs we just talked about. Now, this next part is absolutely crucial. You have to identify the proportion of the wound that's affected. And finally, you use all that info to assign a score. Timing is also everything here. This isn't something you do on day 1 right after surgery. The first formal inspection using the asepsis tool usually happens in a very specific window, between the 5th and 7th day post-op. That's the sweet spot when the first signs of a potential infection are most likely to show up. Okay, so this is where the magic happens. How do we get from seeing some redness or a bit of fluid to a final, objective number that everyone on the team can understand? This quote on the slide really nails the core principle of the system. It's a 2-part deal. First, you identify the characteristic, like, say, that clear serous fluid. And second, you quantify the proportion of the wound that it covers. You absolutely need both pieces to get the right score. This table makes it super clear. Let's just take serous exudates as an example. If that clear fluid is on less than 20% of the wound, that gets a score of 1. Simple. But if it's covering a bit more, say between 20 and 39%, the score bumps up to 2. It's a simple rule. The more of the wound that's involved, the higher the score. And that same basic logic applies right across the board. It doesn't matter if you're looking at redness, that nasty purulent discharge, or tissue separation. The system works the exact same way. You identify the sign, figure out the proportion, and assign the points. Then you just add it all up for a total score. So after all that, we have a number, a single number. But why does that number matter so much? What's the real-world impact of all this? Well, that single number provides total clarity. It lets the entire care team track a wound's progress with objective data, not just hunches. It helps guide those critical treatment decisions. For instance, if a score starts climbing, that might be the trigger to intervene before a small problem becomes a big one. And most importantly, standardizing the whole process means every single patient gets the same high level of care. And that right there is the cornerstone of great medicine. It really makes you think, doesn't it? The Asepsis tool is a perfect example of turning subjective guesswork into powerful, life-saving data. It kind of leaves us with a bigger question. Where else in medicine can this kind of simple, effective standardization completely transform how we care for patients?